My name is Dorothy Chaney. I'm 84 years old. I'm a patient of Dr. Shriwise at Dickson-Diveley Orthopaedic. I had been dealing with knee pain for perhaps 5 years or so before I actually had surgical procedures, but I had gone in and got steroid shots in my knees. And at first they were very, very helpful, and I would go about every 6 months. However, after perhaps 3.5 years or so, for me, it was not working any longer. I still had pain in my knees within perhaps 2 weeks. After much deliberation, when I found the shots were not working, I determined that the only thing I could do was have the surgical procedure.
Dorothy had the underlying diagnosis of osteoarthritis, the medial compartment of both knees, which would be the inner compartment. But on the left side, she also had underlying hardware left over from an old femur fracture that fractured just above the joint line of her knee. She actually developed more pain in the right knee, so we went ahead and did a partial Oxford knee replacement on the right knee. And then that was quite successful, and so she wanted to consider having that done on her left knee.
Dr. Shriwise was always very patient with me because when I had the left knee done, I had had a previous femur break there, so I had lots of equipment in that knee, both bars and screws. And he actually went into the x-ray room with me and held my knee in the position he wanted it so he could see the amount of opening in there for the equipment that he wanted to install.
On Dorothy's left knee, it was a little bit different because she had the underlying hardware. So if you were to do a total knee on that side, the chances were very high that you would need to remove the underlying hardware in order to do the total knee, which then would lead to a more extensive type of total knee replacement. Whereas on the partial knee, the hardware didn't interfere, and so we were able to get by with a much less invasive operation.
At my surgery, I went in early one morning, had the surgical procedure later in the morning, spent the night there. The next day, had to stay until I could go through my first physical therapy there at the hospital, and probably went home around 4 to 5 o'clock that afternoon, the day after surgery. I had home care for perhaps 2 weeks, and then I had physical therapy, and I did that for probably 4 weeks after the home health nurse had stopped. I feel so much better now whenever I raise from a chair. Usually I can walk right away with no pain. And the first time in several years, last year, I attended a Royals game because before it was not feasible that I could climb the steps to get to the seating at the stadium. And now I can.